understanding. Mental illness affects millions of Americans, so it's incredibly important to realize that if you are suffering, you are not alone. Whether it's reaching out to a loved one or a mental health professional, we encourage everyone to take this opportunity to seek the support and connection they need. Our real-life example of putting the 5 core actions into play is having an outdoor costume party or contest. Halloween is right around the corner, and you may be trying to think of fun things to do with your family or neighbors. An outdoor costume contest is a great way to get in the spooky spirit while also staying safe. Conducting the contest outside makes it easier to spread out and maintain physical distancing. Even so, for added protection, consider adding a cloth face covering as part of your costume. However, it's important to realize that a costume mask is not a substitute for a cloth face covering. And you shouldn't wear a costume mask over your cloth face covering because it makes it harder to breathe. Just stick with a cloth face covering. Some retailers are selling creative Halloween-themed cloth face coverings or face masks that would make the perfect addition to any costume. If you don't feel comfortable getting comfortable gathering in person, consider doing a virtual costume contest. That way you can compete with family and friends who aren't in town. It's a great way to celebrate with folks that you don't get to see as often. Those are just a few simple ways you can keep yourself and others healthy while living your life and enjoying the Halloween season. We are continuing to test this week at the main health department location at 140 Dameron Avenue today through Friday, from 9 a.m. to 3 p.m. We have our second public flu vaccination clinic this afternoon at the Jacob Building in Chilhowee Park from 3 p.m. to 6 p.m. We will have flu mist and flu shots available. However, we will not have high-dose flu vaccine at this clinic. Vaccine will be given at no cost to the individual, but we do ask if you have insurance that you please bring your insurance card. Now we'll move into the local situation. We have 114 new confirmed cases since yesterday's report, giving us 10,368 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 448 probable cases. 9,684 of our cases are considered inactive, giving us 1,047 active cases. 384 individuals have been hospitalized at some point in their illness. 50 Knox County residents are currently hospitalized. Fortunately, we have no additional deaths to report today, keeping our total at 85. And so now I'll just open it up for questions.
All right, the first question we have is from Jeff with WATE. He says, can you elaborate a bit on why a costume mask isn't a substitute for a cloth face covering? What comes to mind are astronaut helmets, rubber full coverage masks, and the like. Are those not enough?
They're not. A cloth face covering should be a couple of layers, and it covers your nose and your mouth. If you costume mask have a hole for breathing, usually a hole for your mouth and your nose. And remember, the droplets that you're breathing out or sneezing out or talking out or coughing out are very small, and they could go through those droplets, so it does not reduce risk.
From Daniel at WBIR, active cases are again above 1,000 and hospitalizations have returned to the high from last month. KCHD has attributed previous increases to things like the return of students to schools. Is there any such factor to point to today?
No, honestly, at this point, we don't have a factor to point to. What we know is that people are getting out more. I think people are getting comfortable and relaxing their guard and not practicing the 5 core actions as consistently as they could. I think we've talked about in this briefing that hospitalizations do lag behind active cases. So this bump in hospitalizations might be a result of previous cases. We'll have to wait and see what the data tells us.
From Megan with WBLT, what things should parents keep in mind as they prepare for trick-or-treating?
Social distancing, wearing a mask, washing your hands, not going out to trick-or-treat if you're feeling sick or if you've been asked to quarantine or isolate, and cleaning surfaces frequently. That might include cleaning, wiping candy off when you get back home. Also, if you're going to be offering trick-or-treating, I know the mayor released some information today about safe ways to trick-or-treat, and consider that Don't have something where people come in and grab out of one bowl. Maybe sit out individual things that families can come by and pick up. Trick or treat with your family unit, not with a whole bunch of people you don't know. And so that the release from the mayor had some good points on it too.
Jeff with ATE, Knox County reported more deaths in September than in August. Can we expect a similar trend in the month of October, or does KCHD believe death rates will decline?
All we can do is hope that death rates will decline. We've been fortunate to have a low death rate here in Knox County, although we have reported more deaths than we'd like to see. Any death is unfortunate. We'll just have to see what the data shows us.
From Vincent with the Sentinel, within the past 2 weeks, you have mentioned that parents and students have been avoiding getting tested. Has this continued?
I think anecdotally from our staff, we're hearing that people don't want to continue not to want to be tested. And we're actually being told by students at UT that they're not getting tested. So we're getting those reports from the students themselves.
And his related question was, are you still getting resistance from parents, students, or others?
We continue to have challenges in working with our schools and parents and even university students to get the information that we need. People are reluctant to share information with us. I'm not sure why, for lots of different reasons. But I want to encourage anybody who's listening to, when we call, we're calling to help protect your family and your community and reduce the risk of other people getting sick in your child's school or at your church or wherever it may be. And so please talk to us and give us the information we need so that we can protect others.
From Brian Hornback, President Trump's use of trial treatments appears to have worked rather quickly. Can anyone utilize trial treatments?
I don't believe so. I'm not sure of all the limitations on the drugs that are out there since we don't treat COVID here at the health department. That's probably a better question for hospital practitioners who do actually treat COVID patients.
And Vincent clarified when he was saying resistance, he meant contact tracing, which is, I believe, how you were answering the question.
That's what I was referring to. Yes.
And then Jeff with WATE, do you have any guidance for haunted houses specifically? Recent years have brought a trend of performers getting very close to guests in these attractions. Are you in contact with these operations and do you have advice for them?
My advice to them is follow the 5 core actions. Make it as scary as you want to, as long as you follow the 5 core actions. So figure out a way to do that and have a haunted house with the 5 core actions.
Also from Jeff with WATE, can you shed some light on the change in CDC language when it comes to airborne droplets and physical distances?
So when we look at the data, what we know about the data, the majority of cases, and the CDC says this, the majority of cases of COVID are passed by close interactions with folks that you have regular interactions with or closer interactions for a long period of time through droplets. That's the majority of cases. In certain situations where people are in close contact and there's poor ventilation, the virus can linger. So if you have so that's why we encourage people to open windows, make sure your HVAC systems are working well. So if there's poor ventilation in an area, so the air is not moving, and engineers call it air exchanges or turnovers in the room, that can lead to some lingering of aerosolized particles that can make people sick. But that is not the primary way this virus is passed. The primary way this virus is passed can be avoided by practicing the 5 core actions. So continue to practice those 5 core actions and you will reduce your risk of getting COVID.
From Brian Hornback, if you have had COVID and recovered, why should you wear masks after you are no longer contagious?
Well, it reduces your risk somewhat of getting reinfected. We don't know how long COVID how long the immunity to COVID lasts after you're sick. We think right now it might be about 90 days, but we don't have confirmed data on that. So it just helps reduce risk and models that behavior.
Any other questions? Please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time, and we will see you again for our briefing on Thursday at 12:30. Have a good rest of your day.